Hi, my name is Mary Rose Gahn. I'm from Erie Community College North. We're going to be demonstrating irrigation of an NG tube. Megan Mahoney's here to do that. Megan.
She will place the linen saver pad under the NG tube. She'll open the irrigation set and pour saline into the basin. She will then don clean gloves. And disconnect the NG tube from the suction tubing. She will hold the drainage tubing up until the suction clears it, turn off the suction machine, and then lay it on the linen saver pad, or will hook it over the suction machine. She'll clamp the NG tube or turn off the stopcock. She will then unclamp the tube, attach a syringe with 15 mils of air, and check for correct placement of the NG tube, and then clamp the tube. She's going to inject the 15 mils of air into the NG tube and auscultate to hear a swish.
Now she's going to demonstrate irrigation of the tube.
So she'll fill the syringe with 30 to 50 mils of saline and place it on the linen saver pad. She'll unclamp the NG tube, remove it from the gown if needed for access to the tube, and then attach the syringe. With the syringe, she'll instill the irrigating solution slowly into the NG tube. She will not force the solution or instill the fluid into the air vent. She will then draw back a small amount of fluid to assess patency and then reconnect the tube to suction, or, per agency policy, lower the end of the NG tube and withdraw fluid. She will then reattach the NG tube to the patient's clothing
And
provide comfort measures like mouth care, and then remove and discard her gloves and perform hand hygiene.
connect it back up to suction. She then will connect it back up to suction per agency policy. Okay, next we're going to demonstrate medication administration.
She will begin by preparing the medication correctly. If pouring from a multi-dose container, she does not touch the medication. She pours the correct dosage. She will break only scored tablets or use a pill cutter. For liquid medications, she will shake the bottle as necessary, maintain medical asepsis, does not drip on the label, and wipes only the outside of the bottle lip if dripping occurs. She'll measure at eye level. She'll check to be sure that medications can be crushed and given via enteral tube. She'll crush the tablet and mix it with approximately 20 mils of water, or obtains a liquid medication if needed. If several medications are to be given, she'll mix each one separately. She's going to identify her patient and place in a high Fowler's position. If the patient is on nasogastric tube to decompression, she'll remove from suction and then clamp the tube. She will then unclamp the tube and attach a syringe with 15 mils of air and check for correct placement of the NG tube and then clamp the tube. She will flush the tube, uses the correct type and size syringe per agency policy. Again, she will hear a swish if the tube is in proper placement. Next, she will flush the tube using the correct type and size syringe per agency policy. To give by gravity, she'll remove the plunger from the syringe, attach the barrel to the tube, and pour in 15 to 30 mils of water. To flush the tube, draw up water in the syringe and attach the syringe and slowly flush.
At children's, and when we're doing pediatrics, we only use gravity. Just, I want to underline that for our level 3 students. So we use our saline, we let it go in, we pour our medication with the medication cup.
She's going to administer the medication via method A or B above. If giving more than one medication, she'll give each separately and flush with 5 mils of water after each. After all the medications are instilled, she'll flush the tube by instilling an additional 15 to 30 mils of water, making sure all medication is flushed through the tube.
Anything anyone wants to add?
If the patient's NG tube is set to decompression, you're going to clamp for 20 to 30 minutes before returning to suction. Have the patient maintain a sitting position, if they are able, for at least 30 minutes after medication administration.
And dispose of all supplies. Thank you, Megan.
The end.